Hydrogen, can you save GE? The following is what I have investigated about thrombocytopenia. I sincerely hope that this information will be helpful not only to GE, but also to other patients suffering from thrombocytopenia. 1. What is thrombocytopenia? Thrombocytopenia means that the platelet count in the blood is lower than the normal range. Platelets are blood cells that play an essential role in blood clotting, which is important for stopping bleeding. 2. What is the normal platelet count range? Generally, the normal platelet count is between 150,000 and 450,000 per ml of blood. In GE's case, a platelet count below 15,000 is considered very severe thrombocytopenia. 3. What causes thrombocytopenia? Thrombocytopenia can be caused by various factors. Decreased platelet production. When the bone marrow does not produce enough platelets. Aplastic anemia, leukemia, myelodysplastic syndrome, chemotherapy, radiation therapy, alcohol abuse, vitamin B12 or folate deficiency, etc. Increased platelet destruction. When platelets are destroyed excessively, idiopathic thrombocytopenic purpura, ITP, thrombotic thrombocytopenic purpura, TTP, disseminated intravascular coagulation, DIC, drug-induced thrombocytopenia, autoimmune diseases, infections, etc. Increased platelet consumption. When platelets are excessively consumed in the blood clotting process, disseminated intravascular coagulation, DIC, etc. Hypersplenism. When the spleen enlarges and excessively removes platelets. Dilution. When the platelet concentration in the blood is diluted due to transfusions, etc. 4. What are the types of thrombocytopenia? Thrombocytopenia can be classified into various types depending on the cause. Idiopathic thrombocytopenic purpura, ITP, an autoimmune disease in which antibodies that attack one's own platelets are produced, leading to platelet destruction. Thrombotic thrombocytopenic purpura, TTP, a disease in which excessive small blood clots are formed in the blood, leading to platelet consumption. Drug-induced thrombocytopenia, when thrombocytopenia is induced by certain drugs, heparin, quinine, sulfonamides, etc. Aplastic anemia, a disease in which the bone marrow does not produce enough blood cells, red blood cells, white blood cells, platelets. Disseminated intravascular coagulation, DIC, a disease in which the blood clotting system is abnormally activated, leading to excessive formation of small blood clots in the blood and platelet consumption. 5. How is thrombocytopenia treated? Treatment for thrombocytopenia depends on the cause and severity. Treatment of the cause. Treating the underlying cause of thrombocytopenia. Stopping medication. Treating infections. Treating autoimmune diseases, etc. Medication. Steroids. Used in the treatment of ITP to suppress antibody production and reduce platelet destruction. Immunoglobulin. Used in the treatment of ITP to suppress the action of antibodies that destroy platelets. Platelet production stimulators. Drugs that promote platelet production in the bone marrow, ramiprostone, L-trombopag, etc. Transfusion. Platelet transfusions are performed when platelet counts are very low and the risk of bleeding is high. Splenectomy. Surgical removal of the spleen may be considered in cases of ITP that do not respond to treatment. Since the spleen plays a role in destroying platelets, removing the spleen can increase platelet counts. Bone marrow transplantation. Bone marrow transplantation may be considered in cases where there is a problem with bone marrow function, such as aplastic anemia. 6. How can hydrogen inhalation therapy help with thrombocytopenia? Hydrogen has antioxidant and anti-inflammatory effects, which may be potentially helpful in treating thrombocytopenia. Reduce oxidative stress. Some causes of thrombocytopenia may be related to oxidative stress. Hydrogen removes free radicals, reducing oxidative stress and preventing platelet damage. Relieve inflammation. Some thrombocytopenias may be related to inflammatory reactions. Hydrogen can relieve inflammation, reducing platelet destruction and promoting platelet production. Hydrogen inhalation therapy is still in the research stage, and the efficacy and safety for the treatment of thrombocytopenia must be proven through additional clinical studies. However, the antioxidant and anti-inflammatory effects of hydrogen are expected to have a positive impact on the treatment of thrombocytopenia. 7. What hydrogen research is related to thrombocytopenia? Although there are not many papers directly dealing with the effect of hydrogen on thrombocytopenia, there are many studies on the antioxidant and anti-inflammatory effects of hydrogen. In addition, some studies suggest that hydrogen may have a positive effect on certain blood diseases, such as leukemia and anemia. These research results suggest that hydrogen inhalation therapy may play an auxiliary role in the treatment of thrombocytopenia.